Hi, I'm Justin Kuhns, Managing Director of Pacific Wealth Management, helping you make good financial decisions through sound management for a secure future. Healthcare in the United States is often characterized by world-class technology, renowned research institutions, and innovative treatments. Yet, despite these strengths, Americans face the highest healthcare costs among the world's developed nations. Studies show that administrative expenses account for 25 to 30% of total U.S. healthcare spending, nearly double the rate of countries like Canada or the UK. Hospitals and clinics must hire large billing departments to negotiate payments, process claims, and handle denials. This layer of bureaucracy does not directly improve patient outcomes, but significantly raises the operational costs that are ultimately passed on to consumers through higher insurance premiums and medical bills. A key distinction between the U.S. and other developed health systems is not the quantity of care Americans receive, but the price paid for each of those services. Whether it's a basic MRI scan or a hospital stay, the cost in the United States dwarfs that of other countries. For example, an MRI may cost around $1,100 in the US compared to about $300 in France or $200 in Australia. This price inflation stems from market dynamics in which providers, hospitals, and pharmaceutical companies can set charges with limited government regulation. While many developed nations negotiate or cap prices on a national level, the U.S. allows price setting to be driven by market forces. Large hospital networks and manufacturers often have significant market power, allowing them to negotiate favorable reimbursement rates or maintain monopolistic pricing. Consumers rarely know the true cost of procedures beforehand, and the lack of transparency keeps competition to a minimum. Prescription drug prices in the United States are another major contributor to overall spending. Americans pay more than double the average cost for common medications compared to other developed countries, and this is mainly because of the limited price negotiation and strong patent protections. In countries with a single-payer system, governments negotiate drug prices directly with the pharmaceutical companies or set national formularies that restrict how much can be charged. In contrast, U.S. law prohibits Medicare, the single largest purchaser of pharmaceuticals, from negotiating drug prices directly. As a result, drug makers can charge whatever the market will bear. Advertising also plays a role in this. The U.S. is one of only 2 countries in the world, along with New Zealand, that allows direct-to-consumer pharmaceutical advertising. This practice drives demand for newer, often more expensive drugs, even when cheaper and equally effective alternatives do exist. It's also what allowed for the creation of services such as GoodRx or Mark Cuban's Cost Plus drug company. Certain specialties, such as surgery or radiology, command exceptionally high compensation levels compared to their counterparts in other countries with regulated medical salaries. This drives up the average cost of care across the system, especially in urban and hospital-based settings. The U.S. health system is fragmented in both coverage and delivery. Millions of Americans remain uninsured or underinsured, leading to inefficiencies as hospitals and taxpayers indirectly absorb the costs of uncompensated care. At the end of 2025, the government subsidies that were integral to the affordability of Obamacare, the Affordable Care Act, have now expired. Today, even more people are entering the ranks of uninsured as health insurance costs soar and often exceed housing expenses. This fragmentation also weakens bargaining power. Whereas centralized systems like the National Health Service in the UK or Canada's provincial health authorities can leverage size to negotiate lower prices, the US system's many independent actors such as employers, private insurers, patients, and government programs dilute the collective leverage and permit higher costs at almost every stage of the way. Finally, cultural expectations play a subtle role too. Americans tend to equate more care, more tests, more procedures, more technology with better care. Providers often practice defensive medicine to avoid malpractice lawsuits, ordering unnecessary procedures just to document thoroughness. Additionally, the U.S. invests heavily in advanced medical technology and specialist care, which, while beneficial in certain cases, adds layers of cost unnecessary for most routine health needs. The high cost of U.S. care is not the result of a single cause, but an intricate web of systematic inefficiencies, price distortions, and policy choices. Other developed nations have curbed costs by implementing transparent pricing, simplifying administration, and emphasizing prevention and primary care. Reforming U.S. healthcare will require balancing innovation and cost control, increasing transparency, and aligning financial incentives with patient outcomes rather than service volume. The United States' goal should be to create a system that delivers equitable, efficient, and high-quality care, one that rewards health, not just healthcare. I'm Justin Kuhns, Managing Director of Pacific Wealth Management, and if you found this helpful, Check out our other videos or contact us at www.packwealth.com.